Hello, I'm Mayor Patrick Brown. I'd like to provide you with our weekly update of the COVID-19 efforts in the city of Brampton. I'm joined by our Medical Officer of Health, Dr. Lawrence Lowe, who's been doing a great job throughout Peel Region for Mississauga, Brampton, and Caledon. We're also joined today by Councillor Pat Fertini, who will give a bylaw update, and Councillor Michael Palesci, who will give an update on Brampton's emergency management. And I would note, this is the 100th day since we've had emergency management meetings. The first one was on January 27th, and Alan Normand, our Director of Emergency Management, and Razmeen Syed are also here, given this is the 100th day of emergency management. I want to start off by saying how encouraged I am that we're seeing positive developments in the community. For those that are frustrated by this physical distancing and this being distant from friends and loved ones, I want you to know the measures are working. So as hard as they are working. We're starting to see the beginning of the flattening of the curve in the community. We're seeing real positive signs that the measures that public health has recommended are indeed working. One of the reasons we've continued to see some numbers increase is because we've been testing the long-term care settings. And we have now tested 27 of 28 long-term care facilities, so that process is almost complete, and we'll be moving on to the retirement setting, and you'll hear more about that from Dr. Lawrence Lowe. But Brampton, thank you for your efforts. By and large, 99% of the population who have been following the physical distancing guidelines, your efforts, your sacrifice has been working, and we are making progress. I also today want to acknowledge some of the efforts underway in the city of Brampton and to update you on the progress they've had. I talked a few weeks ago about our backyard garden program. I have been blown away by the participation. We didn't want to see produce, we didn't want to see plants being wasted by our local greenhouse industry, and here we are, 14,000 people have signed up. So we're going to have to cap it at 14,000. We can't take any more on the list, but blown away that this is going to be a record year in the Flower City for backyard gardens. And thank you, Frankie Flowers, who has been doing live chats with residents building their gardens for the first time. Our Economic Support Task Force has been doing great work. We've now worked with 5,000 businesses through our one-to-one support consultation process. We've had 900 small businesses that have engaged with the city through our teletown hall, making them aware of the services that exist municipally, provincially, and federally. Our Senior Support Task Force, and this is a beautiful story. We've said to seniors that if you don't have a loved one in the city that can go to the grocery store for you, we'll find a volunteer in the community to do it for you. If you want your medications picked up, we'll find a volunteer to do it. We have gone on 113 different grocery runs for seniors in the city. We've set up a seniors digital cafe, so we have seniors meeting on Zoom and having coffee together. And I want to thank our local grocery stores who have partnered with us on helping make sure that seniors who don't want to leave their home, who may have existing medical conditions, don't have to. So a big thank you to Longo's, the Indian Bazaar, and Fortino's. Our Social Support Task Force, they have been really working with marginalized communities in our city and the homeless population through the work of Regeneration, Knight's Table, Khalsa Aid, and United Sikhs. We have seen over 1,500 meals and groceries delivered to residents in need, and we've seen 31,000 pounds of food donations to shelters in our community. Incredible, 31,000 pounds of food. So thank you for everyone who has been stepping up with donations to those less fortunate. I also want to thank the Youth Support Task Force. The Youth Support Task Force has been doing mental health, online Zooms, Instagram chats, TikTok videos, and grateful that we have 35 youth organizations working with the city. And so right now, everyone is stepping up. We're trying to make sure that no aspect of our Brampton family is left behind. I'm grateful for these task force, for their ongoing work to work on all cylinders to serve Brampton at this point. The last thing that I wanted to note today before we have our updates is we want to keep this city beautiful. And I continue to be a little bit concerned that I see examples of people throwing their masks or gloves on the ground, and that's not safe at a time when we're trying to be more clean and keep the city sanitized more than ever before. And so we have, council has initiated a process where we're looking at changing the fines from a littering fine to a hazardous materials charge. And so we do take this seriously. So a message is, if you're going to take your gloves off, don't you dare throw them on the ground. Make sure they're disposed of properly. We can't do all this great work of physical distancing, of having the hand sanitizer, being careful in grocery stores, and then being careless on how we dispose of those items. So Brampton, I'm going to ask you to take that seriously, and let's keep up the great work. And on that note, let's hear from our Medical Officer Health, Dr. Lawrence Lowe.
Thank you, Mayor Brown, and good morning, everybody. As of yesterday evening, we have 2,736 cases of COVID-19 in Peel and 145 deaths. This includes 1,215 in Brampton, 41 of whom have tragically passed away. We certainly stand with the families that have experienced loss and have been impacted by this disease. That said, I am pleased to report two key changes in our ongoing pandemic response. Our curve is starting to flatten, and we are starting to see fewer new cases in our communities. And while we remain vigilant in our seniors and congregate settings, outbreaks are being controlled. Some seniors' homes have begun to declare outbreaks over, and together with our hospital and healthcare partners, we have tested the staff and residents at 27 out of 28 long-term care facilities in our region, with the final slated to occur by the end of this week, and are continuing on to retirement homes and other group settings. Mortality and severity also continue to plateau at our local hospitals. We stand with those, as I said, who have been touched by this terrible disease and have lost loved ones. We also stand with those who have sacrificed much to save lives. I truly believe that Bramptonians have helped to avert the worst, and this has been no small feat. Coming together, your efforts have supported Peel Public Health's own response in managing the outbreaks, helping to trace contacts, and providing timely data and information. Together, we have saved lives and protected our frontline workers and responders. But I want to be clear about what flattening the curve means. Flattening the curve does not mean that all is well and back to normal. Flattening the curve simply means that we have controlled the fire. We are now in the driver's seat, but the risk of a wildfire, as seen elsewhere, still lurks. It means what we do now matters that much more. By controlling spread, it is now our decisions that will dictate what happens next. Which brings me to a second change. We have been at this for 8 weeks now, and I know that this week aside, the weather is getting nice and certain seasonal businesses have started up again. Our guidelines and recommendations have not yet changed in order to keep the curve flat. We must continue to physically distance. We should wear a mask in instances outside, non-medical, where distance is not possible. And we must continue to stay home, working from home and leaving only for the essentials: groceries, gas, prescription, healthcare, and exercise. And on exercise, I wanted to provide some guidance. Do go out and enjoy the weather. Do exercise with your pet, or yourself, or with a partner at home. But remember, even when outside, distance is your friend. 2 meters, move and do not congregate. For now, respect the closures that are in place, and ideally, stay close to home outside and pick less crowded hours to emerge. Please do not use exercise as an excuse to head out of town to hike popular trips or day trip to attractions, because scenic hotspots might become viral hotspots if we're not careful. So understand, we have done well. As the curve flattens, we take control. And please do go out and get some fresh air, but be smart and be apart and do not congregate. I'll pass it back to the mayor. Thank you.
Thank you, Dr. Lawrence Lowe, and for the hard work of your entire team at Public Health. We're going to have Councillor Pat Fertini give an update on the bylaw measures, and thank you to Paul Morrison and his team. We've added 10 bylaw officers that are working long hours to make sure that we keep our city safe, and Councillor Fertini will give the latest bylaw update.
Thank you, Mayor Brown, and thank you, and good morning, everyone. So I'm pleased to be here for an update for the bylaw enforcement effort and maintaining physical distancing, upholding public safety within the city of Brampton. In addition, 42 charges were laid this week. 2 individual charges were for under the EMCPA for not identifying themselves to the officers and being uncooperative when the officers arrived. It appears that the weather is improving. So a number of complaints from the residents and visitors are mostly from gathering in their homes. In the past week, there was 230 complaints received through our calling center, resulting in 18 charges being laid. Another incident resulted to 7 charges being laid for a gathering in a plaza parking lot. When the officers arrived, they observed over 30 vehicles and not practicing their social distancing. There was another increase of non-essential businesses violations with 12 charges being laid. A majority of the charges were laid for contracting work, not practicing social distancing. There was also a hair salon in a home being charged. And for the 4th time, an individual was charged for selling produce in a parking lot, and it's some worrisome. It's coming from most of the safety is worried about the health and safety guidelines falling under the Peel Health. And finally, 5 charges were laid for individual using our park equipment. I'd like to thank our bylaw and enforcement for their ensuring the safety of the public and the emergency. Thank you, and I'll pass it to Mayor Brown.
Thank you, Councillor Frattini. As I mentioned before, this is Emergency Preparation Week, and this is the 100th day that our emergency management team has been at work. And to acknowledge their efforts, we have Councillor Michael Pleshy.
Thank you, Mr. Mayor, and good morning. On Monday, the City of Brampton launched Emergency Preparedness Week. Being prepared means that the city will be able to respond to the current emergency effectively and proactively, while focusing on resident and business needs through the various city task forces, which include youth, seniors, small and large businesses, and social support. Every year, Emergency Preparedness Week is a time when residents are prepared for potential emergencies of all kinds, including extreme weather, flooding, and power outages. This year, in light of the COVID-19 pandemic, the city reminds residents of the importance, now more than ever, the vital role that we play in being safe and prepared. Residents are helping to protect themselves against COVID-19 by maintaining physical distancing, staying informed, and following the advice of Peel Public Health. The city encourages and continues these efforts in keeping Brampton safe. Today, as the mayor indicated, is the 100th day since the Emergency Operations Center first met to navigate and respond to the current COVID-19 emergency. The city extends its sincere appreciation to the emergency management team, Brampton Fire and Emergency Services, and the Emergency Management Office. I'm joined today by Alain Normand, Manager of the city's Emergency Management Office, and Rasmeen Saeed, Community Safety and Wellbeing Officer, who is the city's staff lead on the Social Support Task Force. It is emergency management leaders like these 2 amazing people, and Rick, Catherine, Ann, Roland, and Pooja, who are putting their planning and expertise into practice at this time and continue to work together to protect the safety of our community during this pandemic. During these challenging times, we encourage you all to stay home, stay safe, and together we will save lives. We can make a real difference in how we respond to the emergencies that we face as a city. As a single father of 3 active children, it is natural to feel varying emotions about what the new normal will look like. We need to remember and remind each other that as a collective community, we are resilient, and that is how we will overcome this. I'd now like to ask Alain and Rasmeen to come up.
Thank you, Councillor. Thank you, Mr. Mayor. This is, as we said, the 100th day. On January 27th, when we saw that the situation was escalating and the virus was going to come to Canada, we didn't wait. We got into action. We started putting our teams together, and we brushed off on our pandemic plan, which we had developed back in the SARS time. I have to say that in my 30 years in emergency management, this is the longest emergency that I've ever had to deal with. Quite an emergency. But the good thing is that we were prepared, and we're still prepared, and we're still going on because we had these plans, and we have the support of council and senior management to make this happen. And most years, as we said, this is Emergency Preparedness Week this week. Most years it's a normal, we talk about floods and tornadoes and blizzards. This year, of course, the talk is a little bit different. I'm happy that I have Rasmeen with me to assist, and I have a great team behind me, so we're able to do a lot of good work. But we also need to remind that it's our residents that make the difference. Our residents have been helping the city, practicing social distancing and following our rules and our recommendations from Peel Health in order to stop the spread of COVID. We're happy to see this. But I want to remind our resident that this is not over. This is only one type of emergency as well. We're still going to be at risk of having major storms, flooding, tornadoes, windstorms. So we need to be prepared in all different ways. And we recommend that people have the right preparedness and have things at home, supplies ready to go for whatever situation can happen. As the councillor mentioned, Councillor Paleshi mentioned, we have an emergency preparedness guide. We have tools to help you know what to do. You go online and you check our website, and we'll have that. We have a basic rule, three parts: know the risk, have a plan, and build a kit. That's our rule of thumb. And visit Brampton.prepared to find out more about this. I also want to put a plug for our economic development, because this is Economic Development Week, and they've been working very hard on some of the work that with our businesses, as the Mayor mentioned. But we're working together, we're working with them to make sure that we get through this and building an economic resiliency within our city as well. So we're happy to say that this week is Emergency Preparedness Week, and we want everybody to work together on this. And I want to thank you, and lead back to the Mayor. Thank you.
Well, thank you, Rasmeen and Alan, and that concludes our weekly update for this week, but I'd be happy to take any questions that you may have. So I see the first on the list is Sumit from Omni TV.
Hi, Mayor Brown, can you hear me?
I can.
Perfect. So I'm just wondering, a couple of days ago you announced changing a noise bylaw to include all faiths, which received over Twitter what Peel District School Board has called an Islamophobic comment. And so I just want to know, what's your message to the faith-based communities after seeing those negative comments?
So what I would say, first of all, is that Brampton is a mosaic of faiths, and we believe in religious freedom and treating all faiths equally under the law. There should be no single exemption for one faith, and I'm glad that we're in the process of updating our 1984 noise bylaw to make sure that it is equal to all faiths. In terms of some people who resort to hate-based language online, this is a good example that if you're spewing hate online, that you can be accountable for it. Some people feel that a manner in which they would never conduct themselves in person, that somehow you're allowed to spew hate over social media. And the fact that the school, council of this individual, the Board of Education, his place of work have all said they want nothing to do with these comments shows that there are consequences for preaching hate. That's not who we are in Canada. That's not who we are in Brampton. We're an inclusive country and an inclusive community. And I think let this be an example for others that you can't hide behind a Twitter account or a Facebook account and spew hate.
Thank you. I appreciate that. My follow-up is actually for Dr. Lowe. I'm wondering, so yesterday Premier Ford announced that there's kind of more testing kits available than are being done. So I'm wondering, on a municipal level, kind of in Peel Region, do you happen to have numbers of how many testing kits get done daily, or even how many are being done now compared to, say, 4 weeks ago?
Certainly, all testing is actually tracked at the provincial level, and you can actually find the online tracking there at peelregion.ca not peelregion.ca, I apologize, ontario.ca/coronavirus. In terms of the testing that is actually being done in Peel Region, we prefer to identify it by the facilities that are being tested, certainly, and as was mentioned, we have tested almost all the long-term care homes in our region well ahead of the province's date of May 15th for those facilities.
Thank you so much.
Thank you.
Perfect. Thank you so much.
Thank you, Sumit. Our next up is Graham from the Brampton Guardian. Graham?
How's it going, guys? Just a quick question or a follow-up on the. I guess there's some other regions in the world that have found cases that may be predated, in February or December. Any indication that COVID-19 was in Peel earlier than previously thought?
Well, I'll have Dr. Lowe answer that. His team have been doing the tracing and tracking the community spread.
Thanks for the question, Graham. So certainly our region has been, the Region of Peel's Public Health Unit has been in emergency operations since January 23rd. So it's been 104 days for us, and we have been initiating contact tracing pretty much since we received our first case on March 5th. Contact tracing is bread and butter public health, and really it is functionally how we are going to be able to both continue to bring the outbreak under control in our community and also control spread on the go forward. Thank you.
Follow-up would be for Mayor Brown. I'm guessing what funding has been received from the province and the federal government to date in response to COVID-19?
So we haven't received funding per se yet, but we have had communication from the province and federal government that there would be help on the way, and that comes from the Minister of Finance, Rod Phillips, the Minister of Municipal Affairs, Steve Clark, the Deputy Prime Minister, Christopher Freeland, the Minister of Infrastructure, Catherine McKenna. And so we are hearing reassuring collaboration coming from the both levels of government. I would note that there has been funding to the Region of Peel for homelessness, and I believe that funding has been received. And so our social support task force, our efforts on homelessness and food security in Brampton work with the region, and so we've been recipients of some of that provincial funding.
Okay, great, thank you.
Okay. Next up, we have Don McLeod from Brampton Focus.
Morning, Mayor. Premier Ford has indicated that the opening of the Ontario economy is inevitable and businesses should start preparing. Theoretically, if the business is open or he has the province open at the end of May, do you think that is too early? Because you have stated before that you would base your opening on the Peel region or the public health.
So there's two things.
It's saying it's okay. So what is?
So there's two things I would say there. One, we do have a working group led by Councillor Medeiros looking at how the city could safely reopen. So they're doing that work now. They're doing that preparation. When the Premier says we should be doing some of that preparation, it never hurts to be prepared for the type of precautions we're going to have to take under a flattening of the curve and what that new normal looks like. I don't think we're going to be back completely to normal until we have a vaccine, but taking precautions and examining how we're going to do that, I think that is productive work. I'll let Dr. Lowe speak about whether the Victoria Day forecast is realistic. I know in the city of Brampton, we're going to be taking our guidance from Peel Public Health, and Dr. Lowe would be the person that would be giving that guidance, so I think it's best to hear from him on whether he thinks that's a reasonable estimate.
Thank you, Mayor Brown. Thank you, Don, for the question. Peel Public Health continues to monitor the situation in the community, and as I described in my opening remarks, we are certainly starting to see the curve flatten. We do want to make sure that situations in our senior settings are under control, and certainly our situation in the hospital also continues, the picture continues to improve. In terms of where things go, I'd go back to what I said earlier on. We do encourage people to get outside, but certainly make sure they are moving, not congregating, and certainly not going to hotspots, attractions where they may be creating viral clusters. So it's a great question, and we'll continue to encourage people to get outside, but sticking close to home and staying around in small groups with their household members. Thank you.
Thank you. Follow-up question is for the mayor again. The Prime Minister indicated that he would be introducing legislation in the near future to permit municipalities to ban handguns within their city limits. Would you be in favor of banning handguns in Brampton?
So we haven't talked about that as a council yet. You know, my personal opinion is the less guns in our community, the better. I do have the opportunity to sit on the Police Services Board where I get insights into some of our gun and gang problems. I would note I would support any reduction of guns in the community as a starting point, but I really would like to stress that one of the greatest challenges we have in Peel Region with gun crime is the smuggling of weapons. I was talking to our chief, Nishan Derapa, just the other day, and we're looking at 75% of the weapons used in crimes in Peel Region are smuggled from south of the border. And we hear examples that are just astonishing where, you have a mother who goes across the border to get to do some shopping, and they will put arms under their vehicle with a tractor and go pick it up later in the day. And so the criminal organizations have become very sophisticated on how they smuggle weapons into Canada. And it's something that we need to combat. And so I support the chiefs in making this a priority to deal with smuggling. I think that answers Dawn's question. Next up, we have Lucy in Brampton.
Specific plan in place to continue. Hi there, can you hear me?
We can.
Okay, perfect. So is there a specific plan in place to continue providing support to small businesses beyond COVID-19 once it's safe to reopen the economy?
So the municipal support that we provided was a deferral of the property taxes, and it was also for rent relief for not-for-profits and city facilities, and a deferral of rent for any small business in a city facility. We have 41 facilities. That will end when the emergency is over. Whether the federal programs like the $40,000 loan or wage subsidy would continue beyond the pandemic, that's a question we'd have to ask our federal counterparts. But I think a lot of these measures are intended to be for the duration of the pandemic. I do believe there'll be other measures that will come afterwards. I know I've spoken to my provincial and federal colleagues about a significant infrastructure stimulus program that could happen after the pandemic, and so I think there'll be different phases of stimulus that will be happening. I think right now it's just trying to keep businesses afloat, their head above water during this crisis, and then I think we'll be looking at stimulus afterwards. Any follow-up question, Lucy?
No, that's it for me. Thank you.
Well, thank you for all the questions, and until next Wednesday, that's your Brampton COVID-19 update. Thank you to Councillor Paleshi, Councillor Fertini, Alan Normand, Rasmin Syed, and Dr. Lawrence Lowe for being part of this update this week.